Welcome to the Abtrace Pulse podcast. Here we talk about all things healthcare, health tech, and Abtrace. I'm your host, Dr Amina Siddiqui. I'm an NHS GP, and I'm also head of primary care community here at Abtrace. So today I'm really excited to have Dr Simon Doyle as our guest. Welcome, Simon.
Thank you. Thank you very much for having me.
So you've got a really interesting background in career-wise, so, NHS and various other projects. So it'd be really interesting to hear about your journey.
Yeah, sure. So I guess, it has been a little bit different to your typical GP route. I think as everyone does when they start working in the NHS, you quickly realise there's lots of problems that we all need to work together to try and solve. I started working in the NHS over 10 years ago, and then after a few years realised that I wanted to try and bring about some changes in different ways, because we'd really been trying to solve the old problems with old solutions for a long, long time. That led me to actually spend some time doing healthcare consulting, which was really eye-opening. Learned lots of different techniques to solve really complicated problems. And that really developed my passion for technology for solutions, and particularly digital health.
That sounds really exciting. It's exactly as you said, old problems, old solutions. We in the primary care space especially, but also the NHS overall, I think that's exactly it. And actually we just need to look at it with a whole new lens and a new way. So what was it about Abtrace that piqued your interest at the beginning?
Yeah, for sure. So after I'd been spending time in consulting, I came back to the NHS, started working as a GP, and I realised that lots of the similar problems that I'd seen at huge scale in healthcare systems when I was doing consulting really applied on the ground as well in GP practices. Lots of the health tech companies I'd come across were really focusing on secondary care and solutions to be able to bridge the gap for patients in secondary care. I hadn't come across many who were really focusing on the root of the problem as I see it, which is in primary care, because if we fix primary care, we can keep people healthy and we don't need to rely on secondary care. I came across Abtrace when I was actually at a health tech conference, and I was just really impressed by how they really seemed to understand the problem. I quickly learned that was because it was basically designed by a GP, and I think that really shows in the way the solutions are offered by Abtrace. I soon started using it as well in my practice, which I was really lucky to be able to do. And it was really ticking off lots of the problems we were trying to solve.
Lots of people have given us that feedback about, you can tell that it's designed by GPs who really understand the problem. And great that you kind of used it in your practice. How did you and, your colleagues at the practice find it, and how did it have an impact?
Yeah, I think in lots of different ways, because obviously we all have different roles in a practice. We all are responsible for different parts of the patient pathway. So I think all of us had different but really good experiences. So whether it be the HCAs, when they were seeing their patients, they had a really obvious to-do list, basically. The admin staff and practice managers were able to let the automations run, which saved huge amounts of time, because they were then able to just focus on the people who were probably never going to respond to an invitation, whether it was via a manual or an automated message. And they were able to then focus their efforts on those people to be able to fairly distribute their efforts to be able to bring people in. GPs, we use it all the time, especially when signing off scripts. So I just find it so easy when I'm going through the on-call script list to be able to see if anything needs doing or if I'm just okay to issue safely.
Yeah, that sounds like it's had a kind of a really big impact. Can you give me any kind of specific examples of things that you thought, this has really kind of changed the game?
Yeah, I think it was, again, it's the different users and also the different ways of using it. So I think the admin staff have really felt huge benefits. So for example, we turned on automations for blood pressure at one of the practices I've worked with, and within 4 weeks 73% of the overdue blood pressures were complete, which is amazing. So instead of trying to focus on that huge pile of people who were overdue, they just let it run for a month. And then they were able to focus the rest of their efforts in the right place. We've started using it as well at lots of practices in terms of patient education and patient safety. So one of the things that's so often picked up by CQC as not being very well coded is, for example, SGLT2 inhibitors' dangerous side effects, so Fournier's gangrene, DKA. I think we're all probably telling our patients about these really serious side effects, but we're all guilty when we're in a busy clinic of not coding it properly, even if we free text it. So lots of the practices are now setting that annual update to go every year when patients are due their annual advice. So I think we're starting to see the patient safety aspect come through as well, which is really exciting.
Yeah, it's huge to kind of be able to improve patient safety, but also, as you said, by setting it up as an automation, then hopefully reducing massive workload as well.
Exactly, because ultimately that always ends up falling on a pharmacist who has to keep lists of patients and where they're up to in terms of their annual advice, and this just brings it all into line with each other, and we're able to set it up to just run.
Perfect. And there's people that were setting up, how did they find it in terms of ease of use and kind of just learning a new system?
Yeah, for sure. I think in terms of ease of use, that's one of the things that is absolutely critical. And that's also one of the things that I found really attractive about Abtrace. So not only did they seem to fully understand the problem, but also the solution was really easy to use, which is so important. We're all super busy in clinic. We don't have time to learn how to do really complicated things. I think the systems that we're using already in terms of searches in the EHRs are already quite clunky and complex. So the fact that these are quite intuitive and very simple, I think is really important. The users who are setting up the recalls are able to do so on their own after a few training sessions, and the team at Abtrace are always more than happy to sit with the users and set those up in the first instances.
Oh, sounds like everyone kind of really got behind it and became part of daily clinical practice, which
absolutely.
Is great. And in your opinion, what is the best feature of the proactive monitoring tool?
Oh gosh, which is the
if you
best
had to
feature?
pick something.
I think so. I have been using Abtrace for around 2 years now, and now I'm lucky enough to work with Abtrace as well. And throughout that time, I've seen huge changes. So to pick one feature is you're being cruel to me, but I think the automation has to be the main feature. I think that is the thing that is able to save so much time. When I first started, we only really had what we call the patient view. So when I first started working with Abtrace, which was great in itself because it got rid of pop-ups, it got all the information in one place, and it was really easy to use. But since then, since we've introduced the automations and all the messaging and the self-booking links, I think the product has really begun to shine.
Great. Yeah. No, I would agree with you. I think automation is a real game changer. It's the thing that, really frees up your staff. It is reliable. It kind of makes sure the patients are getting the correct information. So yeah, it's a very exciting feature of the tool. So Simon, what do you think the kind of main challenges that we're facing in primary care at the moment?
I think the main challenges are probably similar to those experienced in lots of public services at the moment, but particular for primary care, I would say the complexity of our patients is really making things harder for us in terms of being able to provide the right care for all of the different conditions that somebody may have, but not in a reactive way. So to try and provide that care before they become ill. The second challenge that we're really facing across the board is resources. I think Abtrace has been really pivotal in being able to try and tackle both of those in different ways. So in terms of the complexity, one of the real challenges is keeping track of who has what condition and what condition needs what intervention. So by having Abtrace have those searches coded already and be able to take that load off the practice, I think that's one way that we're able to manage complexity that we've not seen before. In terms of resources, by setting the automations up and just letting them run, that means that practices are able to divert their workforce and their existing workforce to be able to do things that they would not have time to do otherwise. So I think by using intelligent solutions like Abtrace, we are able to chip away at those complex problems that we're trying to fix.
Yeah, absolutely. As you said, the aging patient population, the complexity of patients, and, the diminishing workforce, we really need kind of a more clever solution or, use tech to kind of help us to manage those patients best and provide the absolute best patient care. Exactly. So obviously you're familiar with the Darcy report, and there's certain priorities that, the NHS kind of needs to be shifting. So, mention things like moving from analogue to digital, to a more kind of preventative strategy, and also, that shift from kind of secondary care to primary care. How do you think Abtrace facilitates that?
Yeah, I think they're really important priorities, and I think Abtrace is helping with each of them in a different way. So shifting from analog to digital, in terms of the existing workflows for call and recall, it's really manual. So even if we're using existing tech solutions, like keeping databases on a computer. I don't classify that as a digital solution. I think that's working in an analog way but using a computer. I think by digitizing that process in terms of having a computer that can do those searches and read the codes and keep track of those patient lists, I think that's how Abtrace is helping primary care to move from analog to digital. In terms of focusing on prevention, there's ways in which Abtrace is doing that already. So we have access to all of the codes in the patient's record, and we're able to provide that information back in a really actionable way to practices. So, for example, case finding for commonly missed disease registers is super, super important, because if we don't find those people who are pre-diabetic or have non-diabetic hyperglycemia, and we don't give those the appropriate advice and the appropriate training and the appropriate monitoring, then they're going to progress into diabetes. So by being able to capture those patients at the earliest stage, we're able to prevent that from happening, and practices are able to use those lists that are provided through Abtrace to be able to action it. Absolutely. It's so important to those patients with undocumented chronic disease. We have, I think Abtrace has identified over 60,000, since we've kind of built the tool. And so, these were patients that were just not having monitoring, not having correct medications. So absolutely kind of finding those patients is, such an important step to preventative kind of disease later on. Yeah, exactly. And then that leads into the third priority of moving from hospital to community, because if we don't get the early steps correct, then we can never achieve that. Absolutely. Okay, Simon, final question for me. How do you think Abtrace can help with population health management in the future? I think the key with that is to be able to present the information in a usable way. And I think that's the bit that Abtrace can do that lots of other solutions that I've seen aren't able to do. So there's no point in having information around how poorly you're performing if you then can't turn that into actions, whereas the dashboards that we've been able to create at that population level are able to then turn into actions through the Abtrace automations. Yeah, and I think what the feedback that we've heard is that, PCNs are finding it useful to see, how their practices are doing within that PCN. So that kind of local population level, and this can go to ICB level, where they can see within the ICB how the kind of various practices, and they know where to kind of focus resources. So that's really helpful in a population health management kind of perspective. Yeah, exactly. Thank you so much for joining me today, Simon. It's been really interesting to hear about your journey into health tech and, how you came across Abtrace and your experience with the Abtrace proactive monitoring tool. Thank you. Thank you very much for having me.